I'm Emily Selby. I'm a physical therapist with Kure Pain Management. Today we're going to be talking about and teaching our patients how to engage their core and what that really means. A lot of people hear the term core and don't have a good idea or understanding of what muscles that is made up of. I like to think of the core like a soda can. If you throw a closed soda can, it's going to follow its trajectory pretty far. It's pretty typical. But if you open that soda can, you pop the lid and you throw it, that soda can's going to kind of go end over end in every which direction and not be pretty typical. That's how I like to imagine a poorly supported trunk and core when those muscles aren't working really well. Research has shown us that our multifidi muscles, part of our muscles in our back, our erector spinae muscles, are actually inhibited with back pain. If those are inhibited, it can also affect our other core muscles. So our core is comprised of our transverse abdominal muscle on the front, and it kind of runs from here to here, and it's like a corset. Our pelvic floor on the bottom, our diaphragm on the top, and our erector spinae and our multifidi muscles on the back. So today we're going to teach our patient how to engage her transverse abdominal muscle and then a progression of that exercise once we get a little bit further through their treatment. All right. So Becca, what I'm going to have you do is feel your hip bone just on the other side, on your left side. I'm here. I want you to draw your belly button straight down to your spine like you're trying to put on a tight pair of pants. Good. And relax. Good. And go ahead again. Good. And what I'm feeling is a firming, kind of a tightening underneath my fingers. As she does this, she's also going to get a little bit recruitment of the pelvic floor muscles as well. It's kind of an automatic thing. What I want you to do next is go ahead and hold that for 10 seconds. You don't have to give your hand there, but go ahead and hold for 10 seconds, making sure you're breathing. We're also usually looking to make sure our patients aren't overcompensating, recruiting other muscles. A lot of times we'll see glutes. All good? Awesome.
All good.
We usually hold for 10 seconds. Minimum of 7 seconds is needed to build up isometric strength. So we do 10 seconds because people count really fast. Get a little extra in. All right, so once our patient has gotten pretty good at these, you can do it in sitting, we can try it in standing. Functionally, I'll have people engage their transverses before they move and stand and walk, so before she get out of bed, before she gets out of the chair, just to make sure that we're getting those muscles to turn on faster and more efficiently. They're already working now, but maybe not as much as we want them to be. All right, Becca, we're going to do an exercise for your multifidi muscles next. So go ahead and flip on over. You'll be on your hands and knees. Perfect. So to start, you're going to engage that transverse abdominal muscle like we just did. Good. And then what I'm going to have you do is you're going to reach the opposite arm and the opposite leg kind of straight out at the same time. And down. So what we saw there is her pelvis really rocked. We want to avoid her pelvis tipping like that. Instead of going so far back and up, just do a smaller movement and see if that helps. Good, and relax. So it was much more stable, and that's what we're looking for. So then we'll have you do it on the other side. And she's tipping there a little bit. That's okay. Try a smaller movement. A little better. Good. All right, go ahead and rest. So those are just a couple of the exercises that we use to start to progress our patients and their core strength. A lot of people like to do crunches. They really want that six-pack, but we tell our patients to avoid crunches right now in this period. If you really want to work your core strong, try some planks. So Becca, head over here. Good. So come on up onto your toes too, and then go on up all the way on extended elbows. Yep. Good. Keep that belly button tight. Nice. And so what we're looking for is a nice straight spine here. She's not holding her breath. She's breathing. Everything's nice and tight. No sagging or sway of the back. Good. Come on down. Good. Very good. And you're getting total body recruitment there, which is really functional. When people like to strengthen just the biceps or just the triceps, it's important, but your core is are big muscles and they span across your whole body, so we want to make sure we're doing things that recruit all of them because that's how we function and live about our day. I'm Emily. Thank you for watching, and if you have any questions, see our website at kurepain.com.